Good evening, my lovely people. Still having our discussion on kidney failure. I'm putting more emphasis on this topic because so many people had requested this topic. So many people have been pushing me to discuss about this topic. Before I continue, let me start by appreciating you people for the continued support you are showing me in this channel, because if it were not for your support, this channel could not be where it is at the moment. And if you are there and you have not subscribed, make sure you subscribe and share the videos with your brothers and sisters so that they may reach as many people as possible. And after subscribing, don't forget to put the notification bell on so that whenever I produce a video like this, YouTube will always notify you automatically and you will never miss any of our videos. And for those who are appreciating my work, just continue following my content and will benefit more, because I'll never get tired of educating you people and the community at large. Who gets kidney failure? Is kidney failure specific for a certain group of people, or it can go to any age group, anytime, anyhow? So, who gets kidney failure, or who are prone or susceptible to kidney failure? People of all ages can develop kidney failure, but the risk increases with age. This is very important. And it's a very important point to note that people of all ages can develop kidney failure, but the risk increases with age. That's why you will find that majority of people with kidney failure, are the elderly, because the risk increases with age. You must have a higher risk of developing kidney failure if you have the following. And this is a repetition because we quoted it in another video. Let me repeat again. Who gets kidney failure? People of all ages can develop kidney failure, but the risk increases with age. You may have a higher risk of developing kidney failure if you have, number 1, diabetes, number 2, high blood pressure, number 3, heart disease, number 4, positive family history of kidney failure. Let me repeat this again. You may have a higher risk of developing kidney failure if you have, number 1, diabetes, and most cases uncontrolled diabetes, number 2, high blood pressure, number 3, heart disease, and number 4, positive family history of kidney failure. A point to note, which is very important: the longer you have had these conditions, all the conditions we have just mentioned, the longer you have had these conditions, the greater your risk of chronic failure. Or if you buy time when having the conditions we have just mentioned, you will be predisposing yourself or exposing yourself to chronic kidney failure. Diagnostic tests, and this is very important. Diagnostic tests, or how will you determine, how will you come to a conclusion that a patient or somebody is having kidney failure without guesswork? Diagnostic tests. Doctors use several tests to diagnose kidney failure. Doctors use several tests to diagnose kidney failure. Common tests include the following. Diagnostic tests. Doctors use several tests to diagnose kidney failure. And common tests include the following. Number one, which is very common, urinalysis. Urinalysis. A urine sample, very important. A urine sample can show how much protein or sugar is in your urine. A urine sample can show how much protein or sugar is in your urine. A urinary sediment examination looks for red and white cells, higher levels of bacteria, and high number of cellular casts. Urinalysis. A urine sample can show how much proteins or sugars is in your urine. A sediment examination looks for red and white cells, high levels of bacteria, and high number of cellular casts. Number two, another method of diagnosis, urine volume measurements. Urine volume measurements. Measuring urine output can help diagnose kidney failure. Urine volume measurements. Measuring urine output can help diagnose kidney failure. Low output may suggest the kidney disease is due to urinary blockage. Diagnostic tests. Doctors use several tests to diagnose kidney failure. And common tests include, number one, urinalysis. A urine sample can show how much protein or sugar is in your urine. A sediment examination looks for red and white cells, high levels of bacteria, and a high number of cellular casts. Urine volume measurements. Urine volume measurement. Measuring urine output can help diagnose kidney failure. Measuring urine output can help diagnose kidney failure. Low output may suggest that kidney disease is due to urinary blockage. Low output may suggest that kidney disease is due to urinary blockage. Blood samples. Blood samples. Blood tests can measure substances filtered by your kidneys. Blood tests can measure substances filtered by your kidneys. For example, blood urea nitrogen and creatinine. Blood urea nitrogen and creatinine. A rapid rise in the levels may indicate acute kidney failure. Blood samples. Blood tests can measure substances filtered by your kidneys. For example, blood urea nitrogen, and creatinine. A rapid rise in the levels may indicate acute kidney failure. A rapid rise in these levels can indicate acute kidney failure. Imaging tests. Like ultrasound, MRIs and CT scans provide images of your kidneys and urinary tract to identify issues. Imaging tests. For example, ultrasound, MRIs, CT scans provide images of kidneys and urinary tract to identify issues. Kidney tissue sample. Kidney tissue sample. Doctors use a kidney biopsy to collect and examine tissue samples. Kidney tissue sample. Doctors use a kidney biopsy to collect and examine tissue samples. This marks the end of our video today. Let's continue subscribing, liking, sharing and commenting on our videos so that they may reach as many people as possible, and let's continue giving out topics, because I know each one of us must have a certain condition that disturbs his or her mind, and here I've given each one of us a platform to ask whichever condition you want to know about, and I'll be ready to answer you with my due diligence, the way it should be. Let's have a nice day ahead.